Hi, my name is Adrienne Blaylock, and my project is implementation of music therapy as a non-pharmacological intervention. Surgical procedures provoke anxiety and pain for patients of all ages. Music therapy is a non-pharmacological intervention that can be used in each phase of care. For example, in preoperative stage, many of our patients come in and they have high blood pressure because they are nervous, their anxiety, or maybe because they're in pain already, maybe chronic pain. We try to reassure them that that's okay, that we understand that their blood pressure is going to be high, that they're going to be anxious. And so we just try to provide a calm environment and reassess. In the operative stage, even though the patient is sedated, there's different kinds of sedation. So you'll have a local sedative, or you may have moderate, or you may have general. And so depending on which sedation they had, they may remember part of the procedure. So that's why it's important to keep them calm and relieve their anxiety during procedure. In the recovery phase, they're waking up in a new area and they see strangers. There's a whole different group of people. There's not the same people that were in the operating room with them or that got them ready for procedure. And so therefore, that can promote anxiety, depending on what kind of medications they had can promote anxiety. And then the pain of that they may be having can definitely have an effect on anxiety, and that's where the music can come in, just like a soft, soothing, relaxing music. It really does help. Music is a non-invasive, well-tolerated, and inexpensive intervention that nursing staff and patients can administer without a provider's oversight. We as nurses are the patient's advocates and care for the safety of our patients. This intervention is non-pharmacological, and therefore the nurse doesn't have to wait for the physician's order. Access to music is extremely simple and free, can be accessed from the computers, bedside computers, and most of them are safe to log into and don't have to sign up or, like I say, no fees. And this also helps empower the nurse to think outside the box. So maybe with the music, also implement coolness, warmth, repositioning, and helps empower you to think about other resources that you can use without a physician's order. Improvement of patient care and patient satisfaction. That's a big one. We need our patients to be safe. We want them to be satisfied. We want their families to be satisfied. And we want them to be comfortable. Stage 1, unfreezing. Gather data to support the proposed change. Pain is psychological and physiological. The use of music is cost-efficient and effective at helping relieve pain and anxiety with no side effects. Research shows that out of 73 randomized controlled trials, that 77% agreed that music reduced postoperative pain. 68% stated that postoperative anxiety was decreased. 37% was a reduction in use of medications, and 11% increased patient satisfaction. Unfreezing. Diagnose the problem. Often opioids are considered a first-line treatment option used to treat pain postoperatively, but come with side effects such as nausea, constipation, drowsiness, increased risk of falls, and altered mental status. Adverse effects of opioids and uncontrolled pain may lead to injuries, infections, and prolonged hospital stay and recovery. Communicate the need for change. Discuss barriers against pharmacological interventions. The patient is sedated. Upon arrival to the postoperative phase, the patient may be too sedated to receive more opioid or IV medications like fentanyl or hydromorphone. They may have allergies or contraindications to medications that prevent us from giving them anything for pain. And then post-operative nausea and vomiting. Depending on if they got Zofran in the procedure, if we're treating them from pain in the post-operative stage, then we may have to administer Zofran or Phenergan to keep them comfortable. And then patients often refuse pain medication. They're scared of addiction. And then the risk of toxicity. It's important for the PACU nurse to investigate what the patient got operatively, and then in PACU, and then sometimes preoperatively we medicate. But then at discharge, it's extra important to document and to let the patient's family know what they got, how much medication they got, and then the max dose that they can have in a 24-hour period. Emphasize the empowerment of implementing this practice. Remember, there's no doctor's orders or communication needed. Music is free and accessible on most websites. And then you have faster recovery times. Stage 2, movement, the planning stage. This is a practice change that focuses on implementing non-pharmacological interventions before pharmacological interventions. Compose a list of websites that are approved by administration and follow facility policy. This movement will affect nursing in the pre, intra, and operative phases of care. I will seek volunteers to help implement and maintain the change. And nurses are not required to participate in this intervention, but it's encouraged to help improve practice care. Goals. At least 50% of nurses in pre, intra, and post-operative areas implement music into their practice as of January 1st, 2021. There will be an 8% reduction in the use of pain medications in the intra and post-operative phases within the first 6 months after implementation as of April 1st, 2021. And then number 3, patient satisfaction scores on self-reported surveys will increase by 10% in the first year of implementing change. Identifying support and facing resistance. Plan to send out a short survey via email to employees asking their thoughts and experience with music therapy. I plan to arrange a meeting for faculty that are interested in implementing this intervention, gain support from leaders and coworkers, and employees who are burnt out on their jobs are the ones that will likely resist. Intraoperative nurses may resist depending on the procedure, pace, other staff, and the types of sedation that they're giving. And new employees, they may tend to be more supportive because they're still new. They're looking for their niche, what's working for them, and just learning. Who will this affect? Nurses that choose to practice this change, patients who experience pre, intra, and post-operative pain and anxiety, and family members who are present when the intervention is implemented. Starting on 9/17, we held an initial information session and proposed the idea to administration and received feedback. An email was sent out to the nurses regarding their thoughts on music therapy. We met with the administrators and provided them with a list of reputable websites for music and presented evidence on this practice and reported results of our survey via email. And then we spoke at the monthly meeting about this new implementation, and then in November, we encouraged the implementation via email, and we ran a report on the use of pain medication from the past 2 years to be able to compare within the next year or two. Then for our goal for next year is to we're hoping that at least 50% of our nurses are using this implementation, and that we're having at least 8% decrease in pain medications. And we're hoping that at least 50% of our nurses are continuing to implement this change, and that the patient satisfaction rate will increase by 10% within 1 year. And then next year at this time, we're hoping that a survey of at least 50% of our nurses continuing to use this practice for pain and anxiety. Stage 2, movement, implementing. Encourage the nurses to try this free, simple, out-of-the-box intervention. Share patient testimonies of how music therapy impacted their recovery. And post instructions in each operative area and email directions on how to access recommended music sources and approved genres. Support and encouragement during movement process. Send out monthly emails with stories from faculty nurses about how the intervention impacted their nursing and patient care. Encourage nurses to develop other non-pharmacological interventions for different age populations. Strategies for overcoming resistance. Use effective communication to address and explore reasons for resistance. Respect opinions and provide evidence from patients and research studies to why this practice works. And most importantly, remind staff that this new change in practice isn't mandatory and that no punitive actions will be taken. Evaluate. Evaluation will be reassessed in 6 months when the postoperative patient satisfaction surveys are reviewed. And review nurse testimonies and discuss if there is an effective practice that should be continued. Stage 3, refreezing. Continue to encourage staff to use music as an intervention before seeking out pharmacological therapies. Empower team members to use therapies that do not require a physician order. Patient safety, and evaluate progress and satisfaction ratings in 6 months to reiterate that the change was needed. Have a question, concern, or idea? Provide an open door policy for nurses, available to listen to experiences and obstacles and provide advice. And tell me what worked well and what you think needs to be improved. Give me suggestions. I welcome them. And provide a boost of encouragement and gain confidence. In conclusion, this practice may not work for every patient. Tailor your practice to individual patients. And remember that not every intervention is pharmacological and requires a physician's order. And use critical thinking skills and seek therapies that are safest, effective, and least invasive first.